Welcome to AQMD On the Air. I'm your host, Lior Alpern. Our guest today is Dr. Neal Richman, Director of Programs and Advocacy at Breathe LA. Prior to joining Breathe LA, Dr. Richman served for nearly 20 years at the faculty of the Urban Planning Department at UCLA. Dr. Neal Richman, thank you for joining us.
Thank you for the invitation, and especially I want to express my appreciation to the Air Quality Management District for all of its leadership on air quality over the many decades and the improvements that we've seen in air quality. We have been excited to be a partner with you and look forward to doing that in the future.
Can we start with an overview of Breathe LA, your history, and the goals of programs that you have?
Yeah, and I want to go into this in some detail, so bear with me. But we're a public interest and nonprofit organization, and we are committed to promoting clean air and healthy lungs. And they're very connected together, as you well know. And we do that through research, education, advocacy, and technology. We've been around for over 100 years. We're one of the oldest nonprofits in all of LA County, and we started with people from tuberculosis coming to LA because the air quality was good, and they wanted to recuperate in sanatoriums. But as the issue of tuberculosis got addressed, over time we shifted focus towards other lung health issues as well as air quality. So we have a long history. But let me tell you about research and some of the research we've been doing recently. Again, a lot of it's in public health. In COPD, we've been studying Skype and how to educate people to manage their COPD. We are involved with fitness centers so that there's another way that they can manage it. And the issue of COPD is very important with regards to research because many seniors, we don't think about the relationship between seniors and their response to air quality. We talk about asthma in youth, but seniors are very vulnerable. And I think about the excellent event that you had in Anaheim, bringing seniors together and where we talked about COPD. So we do a lot of work on that, and well as we've done some research, the Breath of Life Index on asthma. With regards to education, we have our Lung Power program, we have our Better Breathers Club program on COPD, and then we have one of our signature programs, O2 for You, on environmental education, which I know is very important to AQMD. And in each of those instances, we work very closely in trying to promote the kinds of education that people need so that they can take action in their communities. We work in low-income areas, we work in neighborhoods that are impacted by air pollution, and we're really seeking to make a difference there. With regards to advocacy, what we've been involved in the last couple years is very involved in the Regional Transportation Plan Sustainable Community Strategy, and I know that you're very aware of that. You know, the goal is, of course, for the state to lower our greenhouse gas emissions, and in order to do that, we have to reduce our vehicle miles traveled, and in order to do that, we have to think about sprawl in a different way. We have to develop nodes of activity and density that link together and integrate land use, housing, transit in a new way. And so we've been very active in promoting that. Now the challenge is, now that we have this grand vision and comprehensive plan, what do we do at a local level? What kind of entitlements are there? What kind of zoning? What kind of general plans? And we really want to be there on this issue. We also, with regards to advocacy, have been involved with green construction at Metro. The green construction program is really important because we want to build out this transit system, but what if in the course of building out the transit system, the communities nearby are harmed by the diesel particulates? It turns out they have amazing filters, and the Metro decided to implement a program to make sure they're using absolutely cutting-edge practices, and we're going to be pushing for that to be adopted in the city of LA, Caltrans, large projects like Farmers Field. So we're very excited about that. And with regards to technology, we see where it's going. Multimedia, multi-platform. We want text messages. We want phone apps. We want to educate in a very different way than we have historically. So we're excited about our research, education, advocacy, and technology program.
Thank you for providing such a comprehensive overview of Breathe LA's programs. And could you give some examples of where you're collaborating with AQMD?
Yeah, I want to talk a little bit about education, and I want to talk about advocacy and the direction of our advocacy program. And I think they're very linked because to be an advocate, you've got to be educated. To be an effective advocate, to have the information that you need. And we don't just want to educate young people and professionals. We want them to take the ideas and the knowledge that they learn and turn it into action. So we see those as integrally related. Our signature program is O2 for You. And as it says, it's oxygen for you. And we talk about it broadly. What it is it's health education curriculum designed specifically at the grade level that we implement. And it's critical because what happened now is there's a fragmentation on sustainability information at the schools. We think young people, they are the future, they are the stewards, and we need to get them the information that they need in a comprehensible way, in a way that energizes them and motivates them to become the advocates for the future. So we cover air pollution, environmental change, health effects of air pollution, toxic indoor environments, kids can make a difference, a variety of topics. We also have a very vigorous program for adult education called the Green Salon Program. Last year in our Green Salon Program we focused on mobility. How do we keep our buses running? We can't just build new transit systems without thinking about our buses as an effective link, and they need to have the operational resources. We did a tour of the harbor. We focused on ultrafines. We had Dr. Paulson, who is an expert, join us, Dr. Freund's teaching us about ultrafines. So we've been moving in green construction. With regards to the direction of some of our advocacy work, I want to build upon this whole discussion of the sustainable community strategy. We are real strong supporters of a change in development pattern. We love to see this new density. We love to see transit. But we also have to be conscious about proximity to freeways and the air quality issues of this new development program. Under the RTP in 2002, 80,000 more people will be within 500 feet, living within 500 feet of a freeway. 130,000 more workers will be within 500 feet of the freeway. We need to look at each of those instances and think clearly about mitigation measures. And they can be simple. They can be a heap air filter. They can be new landscaping. There can be reductions in parking so we don't have so many cars around. There can be triple pane windows. But there are things that we can do. And so we want to take the SCS process forward and make sure that there are no adverse health, or they're minimize and mitigate the adverse health impacts to the residents who are moving into these new communities. So with this kind of integration of education and advocacy, we think we're right in line with the activities of the AQMD.
Maybe we can focus on some particular programs of Breathe LA. Starting with a program you have in the Long Beach area. You mentioned the ports a few minutes ago, and here's a community right adjacent to the ports. You have a 3-year program on lung development in children, monitoring it. Could you explain some of the elements of this program?
Sure. I want to step back a little bit because not everyone is familiar with our ports situation here. The Los Angeles port, San Pedro, is the #1 port in the entire U.S. The Long Beach port is the #2 port. The amount of containers that travel through it are 40% of all the containers in the United States. Transporting those goods not just onto the dock, but through drayage and into the rail system, into the truck system, has a tremendous impact on air quality. The ports are the #1 source of air pollution in LA County. What are the consequences with regards to asthma? In the county of LA, 8% of the children have asthma. In Long Beach, it's about double that number. The #1 reason for admissions into ICUs, pediatric ICUs, for children is asthma. USC study, they looked at lung development at communities across California. Long Beach had the highest proportion of children that had 80% lung development or less. So we're talking about a very serious crisis. And it's a crisis that's known and understood by the harbors. They have a Clean Air Action Plan, and they also, as part of that, have established a mitigation fee that pays for intensive work in these communities to address the impacts that they create. And so we're working with one of those programs on an after-school program that affects 10,000 children with very clear quantitative results that we want. We want 80% of the children to improve their ability at self-managing their asthma. We want to reduce hospitalizations by 10%. We want to reduce absenteeism by 15%. And we have a model where we go out and we work with community-based organizations, treating them to be asthma advocates and asthma educators so that they can work with youth and make a difference in their lives. And we have an adult program as well. Integrated with this, and we're very excited about this, we have a partnership with USC, with the Clinical Translational Science Institute. And they're helping us adapt our curriculum when we're doing this in a way that's particularly appropriate for neighborhood needs, and helping us move stronger and stronger into an evidence-based curriculum so that we can point to the evaluation results that demonstrate that we've made a difference in the community.
Another program of Breathe LA is focusing on the community suffering from COPD. Could you explain some of the elements of this program and why air pollution is such a threat to this community and their impaired lung growth?
Well, Breathe LA was chosen as the Western Center region on COPD by the National Institute of Health. We did kickoff summits around the state to make COPD an issue that there is attention placed upon. There are 12 million diagnosed cases of people with chronic obstructive pulmonary disease in the country. There are 12 million more of people who don't know they have the disease. Why is this important? These people that are undiagnosed have tremendous reactions to air quality issues, and they run into the emergency rooms. There are enormous costs for us, and they haven't been diagnosed. They haven't been diagnosed because spirometry isn't ubiquitous. You know, spirometry and measuring lung capacity is the way to define COPD, and it is not generally used in the medical community. We want that identification. Then we can begin to work with people and tell them how to manage their illness. When are the days not to go out? How to get on the AQMD website and know which are dangerous days for them. That doesn't happen if people don't get diagnosed. So we see that as a critical linkage to your own activities. We're really to protect the health of our seniors.
And you have a program related to COPD with the California Community Foundation and Green Salon and working together with groups that are focused on that disease, correct?
Well, we just had a great summit at the California Endowment, and what was really interesting about the summit is it used to be people with COPD were very weak, very debilitated, but now with new medication, new exercise, they've got a lot of energy and they want to become advocates. They don't only want to be advocates for COPD, they want to be advocates for clean air. I have a fellow who's very active working in Redondo Beach around the siting of a power station because he sees the direct connection between air quality and his disease.
You are a member of AQMD's Environmental Justice Advisory Group. And could you share for our audience a bit about what the issues are that this group focuses on and some examples, again, where Breathe LA is working on programs in these communities and the EJAG is also focused on programs in these communities?
Right. I'm very glad to do that. You know, increasingly, it's, as the realtors say, location, location, location. It is very sad to say, but increasingly geography is becoming destiny. And what I mean by that is the lowest cost housing is in the areas that are next to stationary and mobile pollution sources. Who occupies that lowest cost housing? For its affordability, low-income people do. And very often, people of color don't have as many housing choices due to fair housing issues. They end up in these dwellings. They are disproportionately impacted by air quality from both mobile and stationary sources. So what's great about the EJAG is we all come together. We all share information about the communities and the places that we work to learn to one another, to collaborate together, and also to tell Chairman Liu, who's on the AQMD board, what our concerns are and how to get those communicated to the board in general. I think one of the most important things is it's not easy to know how to plug in. You know, some of this stuff can be pretty technical. I've got a PhD, but I have to say some of this stuff gets pretty technical. So it's wonderful because staff comes and breaks down the issues. They say this is the SIP for LA County. We have to do this because of the National Ambient Air Quality Standards. These are the issues that you might be concerned in. You can make input on March on the policies. We can, in April, we're going to release the draft SIP. This is stuff that is very difficult to know. So I would encourage people to get on the website, to get on emails, and to really connect with AQMD because there are people here like Joe who can help translate some of this more arcane information into ways that you can really make a difference and really work to improve air quality in our region.
And on that theme, are there a few other steps where members of the public can interact directly with Breathe LA? You mentioned a few about AQMD. What are some of the steps that people should take away and know how they can plug in, as you said?
Well, I want to go back to that old quote. I think it's from John Lennon. Think globally, act locally. I'm going to start with my own story. I live 10-minute walk from the Expo line. About 2 weeks ago, when it was free over the weekend, I went on board and I went to 7th and Figueroa. And I think it doesn't stop at a fun ride. It stops at this next stage where we're looking at the Prop R extension. As you know, Prop R generated a half-cent sales tax over 30 years to invest in transit and other transportation improvements. And we're beginning to see Expo, we're beginning to see these investments happen. The mayor has put forth a visionary 30-10 program to build all of these improvements in 10 years. He turned to the federal government and said, finance this income stream that's coming in over 30 years so we can build them all now and jumpstart the economy. And Washington's a little slow these days, you may have noticed. So he has a new plan. Let's just extend beyond 30 years this half-cent sales tax and turn to the private markets to bring the monies forward. We need people involved in this issue. We need people involved in a number of issues. I also was mentioning to you earlier that we're very active in the Clean Up, Green Up campaign. And this is focused on Wilmington, Boyle Heights, and Pacoima. And it's both stationary pollutants and it's also mobile sources. And the concerns there are not just adding new land use controls, new code enforcement to beat up auto repair people and body shops, but it's to provide them incentives to clean up their businesses and to become better local citizens that can work with the community. And we're exactly motivated in those kinds of programs where incentives are there. The 710 issue, very healthy debate going on around that, and people can engage that. This is about cargo transport. This affects people's lives. I particularly like this micro case. Vietnamese associations are getting organized around pollutants from nail parlors. They're concerned that they don't have the information. They want protection for the workers. These are the kinds of issues that are very micro that people enter the process in and then get involved in those issues and larger issues around air quality.
Last question I want to ask you has to do with policy. You mentioned the federal government. Breathe LA is very active here at the state government in Sacramento when it comes to regulatory activity and also funding of programs. Could you give some quick examples of some of the efforts you have in Sacramento, please?
Yeah, I'm very glad. We have a tremendous advocate there, Andy Katz, who's just right on it, and he has a real commitment to air quality, so we're excited about that. One of the things he's moving on and is very interested is we need more electric charging stations for these new vehicles. If we're going to change this whole fleet, we're going to change the way we travel, it's not going to happen if there's only gas stations quarter to quarter. So how do we work with the Department of Energy, how do we work with the legislature to again provide incentives for increasing the numbers of those? So that's really important. Another issue is industrial audits. Regulations happen with industrial audits, and they define this term cost-effective. And cost-effective has historically not included the cost associated with health impacts in communities that are affected by the outputs of these industries. We want to see cost-effective to take into health costs. So we're pushing for that on a legislative level. And then finally, we are very excited about the Community Benefits Fund. We all know about cap and trade, and there are different views about cap and trade. But as these resources are being generated, we believe at minimum 10% need to be invested and focused on those areas that are most impacted by air pollution. We strongly support SB 535, Kevin DeLeon's Senate bill, and look forward to it coming to the governor's desk and being signed by the governor.
Dr. Neal Richman, thank you so much for joining us and giving us an overview of Breathe LA's important work that is helping to clean the air that we breathe. Thank you again.
My pleasure.
And that's our show. I'm Leora Alpern. Thank you for watching AQMD On the Air. Visit us at cleanerconnections.org to learn how you can help us clean the air that we breathe.
Let's work together now.